Over 1.8 million Bay State residents are covered by Mass Health dental insurance. But in our neck of the woods, who's providing those services?
We're getting answers on how one practice is making basic health care more accessible for all tax brackets.
Addressing Mass Health was always a thing I really wanted to do because that's the population that gets the least addressed to the problems, and they have the most problems.
Holyoke Dental is opening their newest location on February 12th. And Dr. Sunith Jan knows the drill when it comes to making proper dental services available to low-income tax brackets.
So, high density population here, a lot of patients not in the highest of the income bracket, so they definitely need health services. I think addressing Mass Health population will, a lot of people have a smile now, they can save their teeth, they can eat properly. Hello, Dina. How are you doing? I heard you were in pain today.
After completing dental school in India, then the University of Michigan, he brought his knowledge to Massachusetts and has since opened 9 offices in just 5 years, all to cater to a population in dire need of proper dental care covered by Mass Health insurance.
I think having these many offices definitely, not fully, but partly has alleviated that problem.
According to Mass Health's Find a Provider services, Holyoke Dental is only one of 7 practices in Holyoke that accepts Mass Health dental coverage, while 1.8 million residents across the state have their coverage.
Mass Health is insurance. If I take Medicaid, the basic insurance, you don't have to pay anything out of pocket.
Mass Health covers all types of basic dental procedures, from biannual cleanings, x-rays, fillings, even root canals, all free of charge. Their coverage for adults is fairly easy to understand.
It will be covered or it won't be covered. If it's not covered, sadly, you have to pay out of pocket for it.
And even then, procedures not covered are typically those in low demand. Jan encourages the use of Mass Health as much as possible if a resident qualifies. It's consistent and simple procedures that keep patients out of his root canal chair. That being said, Jan tells Western Mass News that root canals are covered, and he's performing between 7 to 10 of them on a daily basis. Here's a breakdown of Mass Health qualifications. In order to be eligible, you or your family must fit within these brackets. That makes up a significant portion of Jan's client base.
I would say half and half. You can say, 50%, 60% Mass Health at times, and the rest is definitely private insurances.
No matter the tax bracket, they're fixing one smile at a time.
I think that's the most rewarding, best experience. I have seen so many patients cry, when they see their smile. Oh man, this is me, and trust me, even inside we cry when we see that, oh wow, this is what I really wanted it to be.
Reporting in Holyoke, Abby Carnevale, Western Mass News.